Hello and welcome to Athena Women's Clinic YouTube channel. I'm Dr. Kavi Prasoma. Today we are embarking on a very sensitive and a topic that's very close to my heart. It's affected many of my close friends. So the topic we're going to discuss today is breast cancer. As you all know, breast cancer is becoming more and more common and it's affecting lives that are very close to each and every one of us. But with the right knowledge and proactive steps, we can only hope that we can prevent breast cancer from affecting many of our near and dear ones. In the next few minutes, we'll dive into this topic as much as we can and to gather knowledge that may help us move forward in terms of diagnosis and management. Breast cancer begins when cells in the breast grow uncontrollably. Breast tissue is made up of lobules and ducts. That's where the milk is produced, stored, and passed on to the nipple during breastfeeding. So, breast cancer can affect any of these parts of the breast. The cancer tissue may not only be limited to the breast tissue, but it is very likely it can spread to the adjacent areas or to the draining lymph nodes and, of course, further and beyond the breast tissue as well. There are different types of breast carcinomas. So some of the names are invasive ductal carcinoma or invasive lobular carcinoma, and other types that can be breast disease and inflammatory breast cancer. So these are the medical terms for different types of breast cancer. But in general, what we recommend that you yourself are made aware is something called breast awareness. So if you feel that something is different in the breast, or if you can actually feel a lump, then please go and get it checked out as soon as possible. Even if you're breastfeeding, that is really important that you get it checked out. What are some of the risk factors that you need to know to prevent and act accordingly? First one is age. Increasing in age or increases in age can, of course, increase your risk. Non-modifiable risk factor, but definitely you can look after yourself. Genetics, again, this is something you can't modify. That's something that's passed on from generations to you. So what are the important genetic changes? The BRCA mutation 1 or 2, commonly called as BRCA1 and BRCA2. Family history of breast cancer. It's really important that you draw up the family history and speak to a genetic counselor. They can advise the appropriate surveillance that is suitable for you. Hormonal factors. So prolonged exposure of a woman to hormone will also increase the chance of breast cancer. So early menarche and delayed menopause unfortunately allows the woman to be exposed to hormones for a longer period of time, which again increases the risk of breast cancer. And the last cause, lifestyle factors. So all the causes that we have seen so far are non-modifiable, whereas this is what we call as modifiable. So excessive alcohol consumption, smoking, or high BMI or obesity can all lead to breast cancer as well. But these are modifiable factors, which means you can intervene and change them. What are some of the symptoms that you may notice if there is breast cancer? So the first thing, it could be a simple lump that you may notice in the breast tissue. It may increase in size or may stay the same, but the presence of lump is not normal. Second thing that you need to look out for is the change in the shape of the breast or the size of the breast, which can indirectly mean that there is some abnormal tissue within the breast tissue. Nipple changes may happen, which means there could be some puckering or indrawing of the nipple, or darkening of the nipple, or redness or rash may also appear. The skin covering the breast tissue may also show changes like dimpling, puckering, or orange peel appearance. The last thing is persistent pain. So any pain that is not usual, not going away, again, that may be an indicator as well. Please get it checked out. Let's move to see how we screen and diagnose breast cancer. First things first, breast awareness is really important. So for a woman, if you feel the breast is not normal looking or normal feeling, then definitely you have to have a healthcare professional examine the breast to see if there's an issue. Second thing, screening. Routine screening in Australia is done through screening mammograms, which is done between 45 to 74 years of age. So between 45 and 50 years of age, there's one free mammogram that is available to be performed by the Breast Screen WA, which you can go and book yourself in. From 50 years onwards, screening is recommended to be done every 2 years to to assess ongoing progress. In younger women, because of the difference in the breast tissue density, ultrasound is the first line of imaging that is used. Sometimes mammogram may be used to double check or cross check the information that is obtained on the ultrasound. Definitely biopsy or co-biopsy or fine needle aspiration biopsy is one of the diagnostic options available to confirm the breast cancer diagnosis prior to surgical intervention. And if breast cancer has been diagnosed through any of these methods, to assess its spread, MRI and PET scans may be required. Once the diagnosis has been made, there are lots of treatment options that are available depending on the type of breast cancer. It could be surgical, as in removing the lump itself or removing the breast tissue, or there can be chemotherapy. As you know what chemotherapy is, administering medications that are targeted at breast cancer tissue, or there can be hormone therapy that may be used for breast cancer that is hormone responsive, or radiotherapy wherein the breast cancer is quite localized and there may be some local treatments that are required. If you are someone who has been going through this or is going through this, please be aware that there are support groups available. Of course, your own healthcare professional, your own psychologist, or National Breast Cancer Council is also able to help you in such situations. So this video is only a general outline. If you are experiencing any of these symptoms, please seek advice from your own healthcare professional, or you can make an appointment to see us at athenawomensclinic.com.au. If you do like this YouTube video, please like, subscribe and share with your friends as well.